We're joined this afternoon by Muscatine Community School District Superintendent Clint Christopher and Executive Director with UnityPoint Health here in Muscatine, Angie Johnson, and we're going to answer some questions about COVID-19 and the impact it's having in the Muscatine community. So, Angie, I want to start with you. How are we doing locally at UnityPoint Health with regards to COVID-19 patients?
Thanks for the question, Tony, and I do appreciate the time to be able to share our current state in healthcare, specifically for the Muscatine community, as we are at a critical point. And I'm really anxious for our community to understand where we are. At this time here at Trinity Muscatine Hospital, our intensive care unit is full. We do have some capacity and bed availability within our med-surg unit. We are staying in close connection with our partners in the Quad Cities, along with the University of Iowa, on bed capacity across the region, literally minute by minute, hour by hour, to assure that we know where the best level of care we can transfer patients in the event we need to transfer to a higher acuity level of care. We have seen across the state COVID hospitalizations at an all-time high of 912. That is concerning, as that places a capacity limit on our health systems across the state. It makes it more difficult and challenging to transfer patients that are critically ill. Again, we'll continue to follow our surge plan as we do with the rest of our community partners and other hospitals. However, we are at all-time highs. Outpatient testing and COVID positivity rates are also at an all-time high within our community. The concern there is, as we see those numbers increase, we have historically seen approximately 10% turn into inpatient hospitalization. So while we see the highest ever COVID-19 positive hospital utilization across the state and within our region and locally, as those convert, there is a concern on how we can provide continued safe care to all of our community, which we will, we'll continue to partner. Again, we'll look at surge planning, et cetera, but it does put a huge strain on our health system across the state and locally. Last, I would say our staffing's at critical levels. As we continue to see community exposure increase, that obviously impacts our healthcare workers as well. They're being impacted personally, and then also to care for loved ones that have been impacted by COVID. So staffing continues to be a challenge as we provide care to our patients.
And Clint, for you, the question that people have in the community, how close is the school district to looking at going virtual? We're certainly, within the 15 to 20% 14-day positivity for the county, and then some schools are seeing that 10% absenteeism rate. So what happens next with respects to the folks that are curious about if that'll happen?
Well, Tony, I want to go back to the first time you and I did an interview, and we were talking about the initial plan over the summer. And, and two of the things I said was, one, our plan's going to change. And if our plan looks the same in November or December as it did in August, we probably haven't done something right. So we've continued to adjust our model to really make sure we're keeping staff and students safe. And I also said it's really going to be the community that determines how long we stay safe face-to-face, right? And I do commend our staff and our community for getting us to this point. But again, as Angie was saying, we've watched that positivity rate increase significantly. I believe this morning it's at 19.2%, which, as you mentioned, is between that 15 and 20%. We also have to have a 10% absentee rate of students, and that can or cannot include students who are healthy but quarantined. We've included that, so we're reporting that number. We include that anyway, just because I think that's an important factor in that. And we have some elementaries that are at that level. And so one of the things that I've seen since we started And one of the things I'm proud of is because we're masking at school, we're physically distancing, and we're hand washing, we've had staff test positive, we've had students test positive, but those positive transmissions have occurred outside of our school. And so what it tells me is, what we're doing in school is working, right? And so, right now, we know and have said from the beginning, the best learning environment we can provide is face-to-face in school. And so we're going to continue to try to do the very best we can to do that. And really the limiting factor right now will be staff. And so as more staff are quarantined or isolated or test positive, and that's not just teachers, that's our paraprofessionals, that's our bus drivers, our food nutrition service staff, that's everyone. And so as long as we at an individual building can really staff that building safely and adequately, we're going to continue to deliver in-person learning. And so, but we're going to monitor that very closely. And again, that'll be an individual building decision. And we'll do the best we can to communicate that as soon as possible to our parents and to the community if we make that change, because we also know that impacts the workforce in the community. It impacts our childcare needs, and so there's obviously a lot that's rolled into that. But again, I feel really good about what's happening at school, and so we can continue to do that at school and keep students safe and create that learning environment as long as we can keep staff there.
Angie, what can community members do to help? The biggest thing is controlling the spread, obviously. And we also understand that people might be feeling frustrated and wanting to get back to life as we know it. I did some research on my own, and it seems like a pandemic typically might run up to 18 months. So if that's the case, we'd be looking at June of 2021 before things may have a vaccine or getting back to quote unquote normal. But in the meanwhile, today, this weekend, next week, what do people in Muscatine need to do to help slow that spread down so that it does not overwhelm the healthcare system in our community? Because I think that's important. I think people hear about the healthcare system being impacted and maybe they're thinking it's Iowa City or the Quad Cities. But you just said the impact it's having in Muscatine on Mulberry avenues. What can people do to make a difference?
Right. First and foremost, I 100% understand. I have 6 kiddos of my own. We want to get out and about and get back to a normal way of life. I just encourage everyone to find some unique and fun ways to do the new normal that are in a safe way. So obviously, wear a mask. That's first and foremost. Number one, it's, we've seen great results in healthcare in just masking up. So find some fun, cool masks. I have mine right here with me. You'll see around town. Just to remind everyone that they do matter. It's important to mask. Wash your hands frequently. Get those fun little hand sanitizers. You can go to the store and get the cute little bling on it if you want to. So if you don't have availability to hand wash, utilizing hand sanitation, stay at home when you're sick. That's probably one of the most important. Please stay at home. Practice social distancing, limit your group gathering for safety as much as possible. Again, I know you want to get together. I know you want to have fun. There's cool apps like House Party. We're doing this virtual meeting right now. Find fun ways to be able, I've heard of, having some wine at 5 virtually. Anything you can do to get creative, to practice social distancing and keep group gatherings down. Last but not least, get your flu shot. We have started to see flu inpatient admissions as well, which are adding to the COVID-19 and other capacity limitations on the hospital. So if you could go get your flu shot, please do. Those would be a couple of items. And again, this is real. I think that over the last 8 months, believe it or not, have not been as severe as where we are today. So if there's any time that the community could listen to those items and help us out, I'd really appreciate it.
And Clint, we certainly keep talking about how well students are doing and staff are doing in the schools. You and I both see it, Clint, because we're in the buildings. The rooms are clean, the buildings are clean, the high-touch surfaces are cleaned often. Students are wearing masks, they're doing a great job. We see it all the time. But it really seems like what it's coming down to is if people are not contracting COVID inside of a school building, then what we're doing after 3 p.m. really becomes what matters. So it's one of those conversations where we want to make sure that, like you said, the best learning for our students, and selfishly with 2 kids in the district, I know they need to be in person. So I, as a parent and as an employee, I'm really aware of what we're doing or what we're not doing so that we can stay there. But just talk about that, some advice, because it is going to be on all of us to make sure that we're making an effort so that schools can remain in person, and that we can get through this.
Yeah, and I think, so you're right, it is, although we're doing a great job in the buildings, within the school environment, it really is what's happening outside of there with gatherings with friends and families, and just we've all kind of had that. It's a lot. It's been a long run here, and we miss doing the things that we used to do. But this really is a community issue, and I said to somebody earlier, it's really, right now, it's not about the learning, it's about lives, period. And the more we can do as a community to come together and continue to work together to make an impact on this, the better. And I think about, and I've been in other river communities before, and I'm sure this community is no different. What happens when the floodwaters rise? What does the community do? They go downtown, they start filling those sandbags, and they do their part to protect the community. And wearing a mask, doing that physical distancing, reducing those outside activities, and that good hygiene, that's the same thing. Right now, that is the same thing. We know the waters are rising, and we want to keep this community safe, and that's how we can do that. And I know I'm hearing, what the impact we've seen with staff, that Angie's mentioned with staff. I've heard from other employers in town as well. It's not necessarily something that's happening in the work environment. It's that outside environment. So I think it's important for all of us to continue to share that message that, the more we can do those things we know for sure is working. It's mask, it's physical distancing, and washing our hands, and being really mindful of those interactions with other people. That's what's going to get us through this as a community.
As we kind of conclude, Angie, your staff certainly has been on the front lines with this pandemic the entire time. Hundreds of people are employed, if not more, by UnityPoint Health locally, which also includes Trinity Muscatine Public Health. School district has nearly 1,000 employees that have been there, stepping up to the plate. What do you want the community, Angie, to know about your staff and the work that they've done during the last 8 months? Unprecedented times. Nobody, maybe, I didn't go to medical school, but I can't imagine that there's a chapter on pandemics. Maybe there are, I don't know. But what do you want the community to know about the resiliency of your team locally?
Yeah, I first and foremost need to thank them. Their resiliency is incredible. The amount of hours, time, dedication that they're putting into providing care for our community is above none. Yeah, it gives me goosebumps to think of how amazing they are. They're exhausted though, they're tired. We're trying to do everything we can to give them a break when possible. And they keep showing up every single day with smiles on their face and ready and willing to care for our community. Which is why my ask is, to Clint's point earlier, when we're not seeing an increase in exposure through work, similar to the school district, we're seeing it in the community. So what I'm asking community members to do is to stop the spread so our healthcare heroes can take care of each of them within our healthcare continuum. We do not want to be able to decrease our elective cases. We want to continue to provide elective surgeries, emergent cases, along with treating COVID-19 patients. However, as we see an increase in hospitalizations, occur throughout the community, we will need to look at decreasing that continuum of care, which is not where we want to go. So again, anything we can do to stop the community spread will help our healthcare workers take care of our community.
And Clint, for the district staff, 1,000 strong, there's reasons behind why we put signs out in front of schools and buildings talking about heroes work here and future leaders learn here. Again, educators having to, and I've seen it being in the classes, a class gets over and they're sanitizing every table and door handle and surface. They're being asked to do a lot, but they're meeting the challenge. What do you say to your staff of 1,000+ muskies out there that are working every day during this pandemic?
Well, and I've continued as I do kind of a weekly staff message. I'm just extremely proud of the work that they are doing day in and day out, late hours, whatever it takes, to ensure that our students are learning, and getting the best environment possible. So, again, my ask to them today is very similar to what Angie's was. It's just, you're going to have to do your part outside in the community as well. That we've got to pull together in order to get through this. And again, from the work that our staff is doing, but also our public health officials have done a tremendous job too, and have worked so closely with our staff, our nursing staff. Our nursing staff has done an incredible job in what they're doing every day and the calls that they're making. And it's just, I don't know how many people you could say, well, I was never trained for this. We weren't, and yet they are rising to the occasion. And I'm just so thankful for them. And, again, our custodians and our bus drivers and everyone, our food service, everyone has had to make significant changes to how we do business in order to more safely do that business. So they've continued to, we've continued to ask them to step up, and they have, and it's showing. And so now it's more of a community ask to continue to do that same level of work when they're not at work. And I know that's the hard part, is we're coming up on Thanksgiving, and right now this weekend is going to be a beautiful weekend, and people are going to be out and wanting to group up, and we just have to really. And I think that's the more I've heard from Angie and what's happening in our healthcare system right here, that probably has me more worried, just in terms of how do we meet the needs of the community, than anything we've dealt with yet. And so kudos to Angie and your team and everything that they're doing. And again, we're gonna continue to provide the safest and most effective learning environment possible, and do the best we can to staff that environment. And again, as a staff, we're going to have to continue to think really critically about the decisions we're making outside of the workday in order to help us get through, especially these next few weeks. And again, as we know, we've got a system that's at capacity, and every day we're adding more individuals to that, to the need there. And so anything we can do, we need to do.
Thank you both. I appreciate it. And there's great resources and information available online, both with UnityPoint Health, the Iowa Department of Public Health, the school district website, and the COVID dashboard. Everybody has been transparent and open because it's the only way to communicate effectively as things change rapidly. As Clint alluded to, plans have to change. You have to be prepared to adjust, and keeping in mind that we all just want to get through these tough times. Thank you both very much. I appreciate it.